A sore throat today is annoying. You check your temperature, drink something warm, perhaps take medicine, and expect tomorrow to be better. Now remove the thermometer, remove the pharmacy, the doctor, and even the knowledge that microscopic organisms can cause disease. What remains is a person in pain, a worried group, and one terrifying question. Will this pass, or is this the beginning of the end? One note before we begin. Prehistoric medicine left no instruction manual. What follows is a careful reconstruction from bones, dental calculus, objects, and other archaeological evidence. When the evidence is uncertain, we will say so. So, what did ancient people actually do when they became sick? For most of history, sickness had no visible enemy. A wound could look small, then worsen. A cough could disappear after several days, or spread through an entire camp. Two people could eat the same food, yet only one became ill. Ancient people could observe symptoms, but they could not test blood, identify bacteria, or see viruses. They had no modern antibiotics and no reliable way to know which illness they were facing. So their knowledge began with observation. Who recovered? Which foods could a sick person tolerate? Which plants seemed to change pain? Which injuries healed? And which choices were followed by disaster? Their first medical record was not written on paper. It was stored in memory. One famous example comes from Shanidar cave in northern Iraq. There, archaeologists found the remains of a Neanderthal man known as Shanidar I. He lived tens of thousands of years ago with major physical impairments. His right arm was badly damaged and largely unusable. He also had problems affecting his movement, vision, and hearing. Researchers cannot prove exactly who fed him, protected him, or changed their daily routine for him. But his long survival with so many limitations strongly suggests that his group made room for him. Before any known hospital, prescription, or written medical text, the archaeological record may already show something familiar. A badly impaired person was not automatically left behind. Care could not cure every disease, but food, protection, time, and the presence of other people could give someone a chance they might not have had alone. Bones reveal injuries. Teeth can preserve traces of what entered the mouth. At El Sidrón cave in Spain, researchers studied hardened dental calculus from Neanderthal remains about 49,000 years old. They detected compounds linked to yarrow and chamomile, bitter plants with little nutritional value. Later research on one El Sidrón individual also detected material from poplar. Poplar contains salicylic acid, related to the chemistry behind some modern pain-relieving medicines. That same individual showed evidence of a dental abscess and a gastrointestinal pathogen. This is fascinating, but it is not a prescription written in stone. The evidence is consistent with possible self-medication. It does not prove that the person understood the chemistry, and it does not prove that every plant was deliberately taken as medicine. Still, it shows ancient people interacting with biologically active plants tens of thousands of years ago. Thousands of years later, another clue appeared high in the Alps. Ötzi, the roughly 5,300-year-old Iceman, carried 2 pieces of birch polypore fungus. Each piece was attached to a leather thong. Modern research has identified biologically active compounds in this fungus, and later traditions used it for several practical and medicinal purposes. So perhaps Ötzi carried it as a treatment. But perhaps matters. The fungus may have served another purpose. Archaeology cannot ask him why it was there. The honest conclusion is this: Ötzi carried a fungus that may have been useful. Medicinal use is plausible. It is not proven. That single distinction separates evidence from storytelling. Plants were not the only things ancient people tried. From the Neolithic period onward, archaeologists have found skulls with deliberately made openings. The procedure is called trepanation. Different communities used scraping, cutting, grooving, or drilling. Some skulls show healing around the opening. That means some people survived for a meaningful period afterward. Why was it done? In some cases, it may have followed a serious head injury. Other explanations have been proposed, but the exact purpose is often impossible to recover, and it probably differed between communities. The strongest fact is also the simplest. Some Stone Age groups had enough practical skill to perform the procedure without every patient dying immediately. That is remarkable. It does not prove that the procedure cured the original problem. It is easy to turn these discoveries into a comforting story about lost ancient wisdom. That would be dishonest. A plant that reduced pain could not reliably stop every severe infection. A skilled procedure could still end badly. A group could care faithfully for someone and still lose them. Ancient knowledge had hard limits. People could not identify most pathogens. They could not produce modern antibiotics. They could not replace lost fluids through an intravenous line or support failing organs inside an intensive care unit. When an illness became severe, they had far fewer ways to respond. And because most prehistoric communities left no written case reports, failure could erase knowledge as easily as success could preserve it. So how could any useful method last? Perhaps through repetition, teaching, and memory. Perhaps someone noticed that a certain plant was followed by less pain. Someone remembered which wound worsened. A parent taught a child. An experienced person showed another what had appeared to help before. This was not a perfect chain of progress. People could mistake coincidence for treatment. Someone might recover after a useless remedy, while another person might die despite receiving something helpful. But careful observation could preserve some useful practices across generations. The person treating the sick was not commanding life and death. He or she was using limited knowledge, limited tools, and the means available at that time. It was not modern medicine, but it contained principles medicine still depends on. Observe carefully, remember honestly, and pass useful knowledge forward. The most important clue may not be a mushroom, a bitter leaf, or an opening in ancient bone. It may be the decision not to walk away. Shanidar I could not live like a healthy hunter, yet the evidence suggests that his life continued among others for years. That tells us something medicine still depends on today. Treatment is not only a substance placed into the body, it is attention, it is patience, it is knowledge carried responsibly, and it is mercy towards someone who has become weak. Ancient people used the means available to them. Sometimes those means helped, sometimes they failed. Healing was never something they could command or guarantee. By the permission of the Creator, some recovered, and what people learned from those recoveries could be remembered and passed forward. The next time a small tablet eases your pain, remember how long the road behind it really is. Not a straight road, not a road of perfect knowledge, a road marked by observation, error, care, loss, and the refusal to leave every sick person alone in the dark. Perhaps the oldest part of medicine was never the remedy itself. Perhaps it was the hand that stayed.